Taye Diggs has recently brought attention to the critical need for early detection of cancer, drawing from his own heartbreaking experiences after the deaths of his mother and stepfather due to the disease. The 55-year-old actor and singer, recognized for his work in American entertainment, shared that his stepfather, Jeffries Diggs, lost his battle with colon cancer many years ago, while his mother, Marcia Berry, passed away shortly after her own cancer diagnosis. This personal tragedy has motivated him to speak out, urging others to prioritize health screenings that could potentially save lives. In a detailed discussion, Diggs expressed his sorrow over the untimely passing of both parents, noting that they left this world earlier than anticipated because of various forms of cancer. He emphasized the frustration that comes when such outcomes might have been preventable through proactive measures. He pointed out that it deeply bothers him when people fail to take advantage of available tools and resources for early detection, especially given how avoidable some tragedies can be. Using his own situation as a poignant example, he reiterated that both of his parents succumbed to the illness, underscoring the emotional weight of these losses and the lessons they impart. Delving into the specifics of his mother's story, Diggs recalled a conversation where he learned more about her final days. Marcia Berry was not only a loving parent but also a talented performer, an educator as a professor, and someone pursuing advanced studies as a PhD candidate at a university. Despite her strength and accomplishments, she chose to keep her initial health concerns private, not informing anyone about her symptoms at first. She began feeling unusual but, being the resilient person she was, pushed through without seeking immediate help. It wasn't until her condition worsened significantly that the family intervened, taking her to the hospital for evaluation. There, medical professionals delivered the devastating news: she had cancer and her time was limited. Tragically, she passed away soon after, leaving a void that Diggs and his family continue to feel. This experience has profoundly shaped Diggs's perspective on health and prevention. Motivated by these losses, he has partnered with an initiative focused on advancing cancer detection methods. Specifically, he is collaborating with a program that promotes a blood-based test designed to identify multiple types of cancer in adults. This innovative approach works by detecting any abnormal protein markers in the blood, which could signal the presence of cancer and prompt individuals to seek further medical investigation. Importantly, Diggs clarified that this test is not intended to replace traditional cancer screenings but rather to complement them, serving as an additional layer of vigilance in health management. Expressing his surprise upon learning about such advancements, Diggs admitted that he was unaware these options even existed during the time his parents were ill. He reflected on how different things might have been if they had access to these tools, suggesting that he wouldn't be facing the grief he does today. Now, armed with this knowledge, he is passionate about spreading awareness, insisting that with cutting-edge solutions available through scientific developments, there is simply no valid excuse for people to neglect getting tested. His message is clear: proactive steps can make all the difference in outcomes. Expanding on the importance of early detection, Diggs's advocacy aligns with broader public health efforts to combat cancer, one of the leading causes of death worldwide. By sharing his story, he humanizes the statistics, showing how the disease affects families across all walks of life, including those in the public eye. Early detection allows for interventions at stages where treatments are more effective, potentially increasing survival rates and improving quality of life. Methods like blood tests offer a less invasive alternative to some traditional screenings, making it easier for people to incorporate them into routine checkups. Diggs's personal narrative also highlights the emotional and psychological aspects of dealing with cancer in a family. The decision by his mother to initially withhold her diagnosis speaks to common behaviors where individuals might downplay symptoms out of fear, denial, or a desire not to burden loved ones. This trooper mentality, while admirable in resilience, can delay critical care. Diggs's recounting serves as a cautionary tale, encouraging open communication about health concerns within families to ensure timely support and medical attention. Furthermore, his collaboration with cancer detection initiatives demonstrates a commitment to turning personal pain into positive action. By aligning with tests that scan for multiple cancers through simple blood draws, he promotes accessibility and innovation in healthcare. These tests analyze biomarkers that could indicate early cellular changes, allowing doctors to follow up with targeted diagnostics like imaging or biopsies. While not a standalone solution, they bridge gaps in screening protocols, especially for cancers that might not have routine checks, such as pancreatic or ovarian. In reflecting on his stepfather's battle with colon cancer, Diggs implicitly stresses the value of specific screenings like colonoscopies, which are proven to detect precancerous polyps. Colon cancer in particular is often preventable if caught early, yet many avoid screenings due to discomfort or lack of awareness. Diggs's story urges a shift in mindset, from reactive to preventive healthcare. Beyond the medical aspects, Diggs's advocacy touches on grief and healing. Losing both parents to cancer is a profound loss, compounded by the what-if questions about earlier interventions. By speaking publicly, he not only honors their memory but also helps others process similar experiences, fostering a community of support. This openness can reduce stigma around cancer discussions, encouraging more people to share their stories and seek help. The partnership with blood-based testing also represents progress in personalized medicine. Advances in biotechnology enable multi-cancer detection, potentially revolutionizing how we approach disease prevention. Diggs's endorsement adds a relatable voice to these scientific breakthroughs, making complex concepts accessible to the general public.